787. That means we going from back to front. Don't go what? Back to front mean there. We did one. Right? Let's go. The first disease NCLEX asks you how to remove wax from the ear. Now, you remember yesterday I told you the medication to put in the ear for wax is Devorax. Remember we talked about that? Now, NCLEX asks you how to use this and also how to irrigate the ear. Ready? Let's go. Page 787. S. Highlight that. New people, anytime I do something in class, that is the something you must study. Okay? See? Turn off the phone. It's okay, just turn it off. Okay? So let's go. Serum or wax is the most common cause impacted canals. Right? Boucher. Data collection. Right? Sensation of fullness in the ear. The patient may have pain, itching, or bleeding. We remove of wax by irrigation. Remember yesterday, Miss Sonia said one of the skills was irrigation, to put water in the ear. True? So let's go. Irrigation is contraindicated in clients with history of tympanic membrane proliferation or otitis media, which is earache. Anytime you have history of earache, problem with ear, you cannot go irrigate Zoe, put water in ear. All right? So who will not do this? Anybody got history of earache, right? Let's continue. The first thing you will do, you will soften the wax. Make it soft, right? Add 3 drops of glycerin or mineral oil at bedtime, and 3 drops of hydrogen peroxide twice a day. After several days, then you irrigate the ear. So again, listen to me. You put the mineral oil, you let it soften. Let's say 2 days. Then you go wash it. You don't go wash it right away. How much fluid you can put in the ear? Between 50 to 70 cc. No more than that. But listen, in the hospital, because I have to teach you hospital and life. L'hôpital, the doctor in the ER will order 100 cc. But like for NCLEX, say 50 to 70 is the max. Irrigation is low, water to wash the ear. Okay? Any question? Highlight that. Now, how do I remove foreign bodies? Foreign bodies is what fall in the ear. What goes in the ear? Sometimes, on ti poa, a pea, ti moun ap jwe, ti moun nan fouwe on ti poa nan zoe la. A pea, vegetable in the ear. A bug in the ear. As an ER nurse, this is what I see on an average Saturday. Kids stick pea in nose. Kids stick pea in ear. A fly, zoom, go in the ear. NCLEX question. How do we remove that? Ready? If it is a pea, Creole, petit pois. English, I'm coming back. Hold on with me. Si on ti pois, ou pas mette de l'eau. Ou pas mette de l'eau pour qui ça de l'eau, ou l'on mette de l'eau dans pois, la paye fait pois vin gros. English, anytime it's a vegetable matter that goes in the ear, 2-year-old love to stick stuff in the ear. If it's a vegetable matter like a pea, beans, and you put water, it make it expand. So you never irrigate the ear when it is a pea or bean. Any question? Or if the doctor do order it, he will do it, not the nurse. Because you got to be very careful. Now it's going to be hard to take out, right? And the child may have problem with hearing. Now, What about if a bug fall in the ear? Like a zzz, like a little bee or mosquito. There you go. You can force it to come out with what? A horn. A horn. So NCLEX asks you, when a mosquito goes in the ear or fly, what do you see at the bedside? A blowhorn. How you say? Klaxon. Right? A horn. You know why? Because that's going to force the mosquito, the fly, to come out. That's an NCLEX question. Go to page 4. I talked about A. I need you to stay with me this morning. A. I talked about B. Humming noise. NCLEX don't put humming noise. They put a horn. That's the answer. Or flashlight. B. Now, if you did that and the fly didn't come out, what do you now do? You got to kill it. You got to kill it. Now, Zoela. You got to kill it in the ear. With what we will kill it, we need to suffocate it. The fly in the ear. Ready? So you suffocate it with dilated alcohol, right? Or mineral oil, and then you remove it with a forceps. Now, NCLEX asks you, how do you remove it with a forceps? I'm going to use Francis, and you're going to watch this way. When you remove it with a forceps, everybody know what a forceps is. Mm-hmm. Now, you got to come up if you can't see. But he's taller than me. Walk up. Okay? Now, look. To remove it, you got to remember, when you remove it, you don't remove because you kind of what? Forcing it in. So when you remove it, you got to pull the ear back, right? And then you go down. You see? Down. I took the ear, I pulled back. So it can give me leverage. Then I take the forceps, I don't go in, because it's going to go in. I go down. Down. You guys see that? You need to hold on to it so you can have leverage. Sorry. You got it? They ask you how to remove stuff from the ear. You cannot go in. You got to go down. Just like y'all cleaning the ear. Let me show you the way you use a Q-tip. You don't go like this. Look. You see? You don't go. Look. You go down. Down. You know why? Because when you go, you stick it in and you hit the tympanic membrane. You see, the plim pool, the Haitian people use the plim pool, the little feather. My ex-husband, German, he'll go, can you bring a plim pool? I said, what do you know about plim pool? Right? He used to ask all the time. But sometime when you use the plim pool a lot and the ear hurt, it's not because you stuck it in. You got to remember, the plim pool is made of feather. It's because the plim pool is dirty. The bacteria, that's the one caused the ear to ache. But the Q-tip is puffy. So it's because you perforate it by sticking it in too far. You don't go in, guys. You always clean down. And you remove down. You got it? Make sure you know that for me. NCLEX. So foreign bodies, 4. A, B, C, D. Number 1 NCLEX question. Musla. You see the fly? When the fly go in the ear, they ask that. Very big on the people test. What do you see at the bedside? You see, your book say humming noise. Guys, you know the purpose of the noise? Pour faire ti fly la sortie. To make the fly, the bee, whatever went in the ear, rush out. Doesn't that make sense?
Yeah.
We use that in the ER a lot. Any question? Now, another thing that NCLEX asks you guys a lot that I'm going to talk about, and you can make a little note, is anytime you see a piece of glass get under my hand or under my feet or a nail, I step on a nail, all right? Anytime those things happen, the first thing I will do as an ER nurse, give you a tetanus shot automatically. Depuis clou, nail in the hand, nail on the feet. You know why? Because of the poison. A piece of glass. Sometimes a piece of glass went under the patient's hand, and the patient cannot even move the finger. It's just that swollen. So we will give them a tetanus shot. We will give them antibiotic, and the doctor will do what we call an IND. They will take it, cut it, and remove the glass. All right, it's called, IND is called incision and drainage, because the hand is so big and sometimes you see pus. All right, always remember that. Nail under the feet, a piece of glass in the finger, burns, animal bit you, a dog, a cat, a rabbit, a snake, tetanus shot. I don't care if you say you had it 2 years ago. Tetanus shot. Anytime you come to the ER, and as an ER nurse on a Saturday, you're going to see a lot of those. All right? Any question? Or I slam my hand in the door. Boy, you know how people close the door? Boom! The hand just this big, tetanus shot right away. Any question? T-E-T, tetanus. Right? And was it AUS or NUS? NUS. Tetanus. It's a shot. Okay? All right. I'll show you, Mom. All right. Any question? Let's move. Now we are on page 786P. 786P. Something called Menieres Syndrome. Now, in NCLEX, you will not see Menieres Syndrome. They real swift with this one. They will put labyrinthitis, they can put that, or they will put endolymphatic hydrops. Anytime they put those English, you automatically know that has to do with the fluid that help with the balance of the body. Now, Menieres Syndrome, which is also called endolymphatic hydrop, refers to the overproduction or the decreased reabsorption of endolymphatic fluid. The endolymphatic fluid help you with balance, right? Very, very important. If it's too much, it causes headache, it causes vertigo, it causes your eyes to involuntary movement, nystagmus, right? Anytime you have Menieres syndrome, you vomit, that's a medical emergency. Anytime you have Menieres syndrome, it is a medical emergency. Now, this fluid has a lot to do with salt too. So when you have Menieres syndrome, you want to limit the amount of salt you take in, and you also want to limit your fluid. Very important. You want to limit salt and you want to limit fluid. So NCLEX can ask you a question has to do with nutrition, and NCLEX can ask you a question has to do with safety. Patient can sit and patient not see. The room is turning, right? Now, there's a medication they will give the patient. And the medication they will give the patient is called niacin. You remember, where did Miss Sonia teach you niacin? Old students. Niacin, yes, I taught it in fundamental nutrition, but I also taught niacin in med-surg, cardio, anti-lipid drugs. Niacin help you with cholesterol, but anytime you take niacin, niacin don't move by itself. Niacin need aspirin. So anytime you take niacin, you gotta take aspirin 30 minutes before, right? Because niacin is also called a vasodilator. All right? Now, nursing intervention for this patient, right? They have medication and they have non-medication. So let's talk about the non-medication. Prevent injury during vertigo attack. The patient can just wake up and start vomiting. That is a Menieres attack, right? Vomit. Provide bed rest. Provide assistance with walking because they will fall. Initiate sodium and fluid restriction. No smoking. Boy, no smoking, no cafe, no chocolate, right? You will give them niacin. Because they're vomit, you're going to give them antiemetic. Where did I teach you antiemetic? Med-surg, GI. Your antiemetics are what? What are the drugs for nausea and vomiting? Phenergan. What else? Zofran. Okay? Make sure you guys know those things, that you give that. Any question? Priority here is safety. Priority here is safety. Patient ka tombe because of the fluid. Listen, NCLEX can put Menieres Syndrome. NCLEX can put endolymphatic hydrops. And NCLEX can put O. You see O? Where O? You look at O. O. They can say limbranitis. When they say that, you must know that is related to that fluid. O, 786O. You see it? That word. This word. Sometimes they're talking about Menieres Syndrome. They don't put Menieres Syndrome, they put LVN right there. You must know it's the same thing. Any question? So far, in ear, I taught you how to remove object from the ear. I taught you all the medication yesterday on ear and eye. True? Make sure we know that. Okay? Our next disease, and you going to study, because you trust me, we got a trusting relationship. You trust me, I trust you. You only going to study what I sent you to study. Capiche? Capiche. All right. Don't go read all the book. I didn't send you to go read all the book. I didn't do all the book. All right. Okay. Praise God. All right. Then we're going to go into 784K. 784K. I want you to make a note. I, Shakita Rowland, whatever your initial is, my name, Shakita. I'm serious. I cannot open Pearson door without it. I cannot. Guys, you got to put your stuff under your seat. All the chairs have to be available for students because it's going to be a lot. All the chairs are filled. So please take your item, stick it under your chair so everybody can sit. Make sure we're not plugging nothing against this wall. If city come in, they should be able to walk through the back door and walk through the front door. So make sure everybody is able to sit. Stick your things under your seat so no one will fall. Everybody can go to the bathroom. Okay? Like this chair here, this one don't supposed to be. Right? This and this. Why? Because if city come, you see how tight it is. If it's it's a fire, you should be able to run out this door. So these 2 chairs, it's okay today, but tomorrow they won't be here. Safety, you see, it shouldn't be so tight, so you won't defeat, right? Okay, so let's continue. Now, okay, you remember, in peds, I did not do ear infection. You see why? Because it is done here. Earache, ear infection can happen to gamun and timun. Big people and little people. So when we say earache, it's for all age. So I don't teach it in peds. I teach it right here. And ear infection is called chronic otitis media. Now, what causes ear infection? Okay, it can be something bacterial, inflammation, or we can perforate. Perforate means fouet on bagay. Stick something in the ear. Now, we can give you medication, which always work, or we will put a tube in the ear. Again, when you have earache, we can fix it with medication, or we can put a tube in the ear. When they put the tube in the ear, that tube is put because all the medication we give you does not work, right? So therefore, they put this tube. Who's at risk for a lot of earache? Kids who are born with what disease? Cleft lip palate, and one more. It's a GI disease. Peds GI. Peds GI. So your peds test next week. So give me all the list peds GI. Oh! GI. Pyloric stenosis. One more. Interception. Ooh. Why would you say cystic fibrosis? You meant to say celiac. I got you. Now, when you have chronic ear infection, you remember yesterday I said there's one drug we will give you, and that drug is called acetic acid. So I give it to you. There's a seat there. There's a seat there. There's a seat there. It should be about 4 seats. Okay? When we give you the acetic acid does not work. It should work, but when it does not work, they will put a tube. Now, that tube is called Myring Atomy, or they call it tympanostomy. On your mama, papa, peds, mama, papa, this is on it. I did not put Myring Atomy. I put tympanostomy, which is the same thing as Myring Atomy. Again, when we give you medication and the medication don't work, now we're going to put a tube in the ear, and that tube is what we call a Myring Atomy or tympanostomy. That because they call it tympanostomy, that means we put it in the tympanic membrane, part of the ear, right? And let's talk about this tube. This tube, a lot of times, drop by itself. It don't big. You don't have to go and remove it. And sometimes the doctor go and remove it. So let's talk about this tube. The tube, when you have it, box 5413, avoid strenuous activity. So NCLEX asks you which activity the kid cannot do. No basketball, no kickball, no football, no strenuous activity. Avoid rapid head movement. Avoid straining. That's why they will give this child stool softener. Avoid drinking through a straw. NCLEX question. Let me tell you the way they give this. The child had a Myring Atomy, oiomete tympanostomy. What did the child say? The mommy said she needs further teaching. When the mommy said, I'm bringing a straw with lunch for him to school so he can drink his juice. No straws. Or mommy said, we're going on vacation to Jamaica. No high altitude, no rapids, no slide, none of those. No high altitude. Ready? Avoid forceful coughing. Avoid contact with person with cold, people with immune suppressed. Avoid washing hair, showering, or getting the head wet for 1 week. And they go the NCLEX question. Instruct the client when he and she needs to blow the nose. There you go. Blow the nose one side at a time with the mouth open. Sana testimony. How to blow the nose, not testimony. Okay? Instruct the client to keep the ears dry by putting where Vaseline, you take the cotton ball, you put petroleum and you put in the ear. No swimming, you cannot get the ear wet. Okay? Now, when would you call the doctor? When drainage come out the ear. So you go to NCLEX and they ask you tympanostomy. You already know. Myring Atomy. You already know. Now, sometimes they use this English called Mestaditis. What does that mean? Mestaditis is inflammation of the mestod part of the ear. Let me explain something to you. Sometimes you have an ear infection and it affects certain area in the ear. So that's the same thing, ear infection. We give you medication, it don't work, we put a what?
The tube.
The tube. What is the tube called? Myring Atomy. If they don't see if you don't see Myring Atomy, they put tympanostomy. Same thing. And on my mama papa, I can put this in peds, I can put it in med-surg, I can put it anywhere because Miss Sonia told you everybody get what?
Ear
infection. Any question? So far, I taught you how to remove stuff in the ear. Something vegetable, a fly. I told you about Menieres Syndrome. I told you about ear infection. I told you the different language they can use. Mestaditis, Myring Atomy, tympanostomy. I told you the Menieres disease, they can change the English on you. I told you about endolymphatic hydrops. I told you that L word, labyrinthis, they can use. There's several English that they can use. So you need to be prepared. When you see the English, you don't care. You're going to bring me with you. You're going to say, where did Miss Sonia teach me this? All right? Any question? Yes.
Okay, so after they have the procedure, how would you position them? Flat,
Okay.
to the side?
What position, what procedure? The Myring Atomy? Let's go to post-op. Let's go to post-op right here. You see it? Look at post-op. You see 5? Monitor for dizziness. Monitor for sign of meningitis. You see that? Prepare for wound dressing change every 24 hours. Change 24 hours post-op, pardon. Monitor for drainage. Position the client flat with the operative side up. Common sense. Anytime you have a surgery on somewhere, the only time you will put me on the same side is appendix. Appendix. I had surgery here. What position me here? I had ear surgery here. What position me here? You understand? Appendicitis. I have surgery here. After the procedure, you won't put me there. anytime I have a procedure on anything, you always going to put me on the unoperative side, except what? Appendicitis. Appendectomy. Any question? We cool? Conessa. You are responsible to read page 784. K, all of K. All of K. I cannot read the book for you. All I can do is give you, make you understand, and it's your job to go read. K, L. L, go 4, do 5. Any question? L, you go 784K, box 5413. L, tout L. C'est pas just L, tout L. L got 1, 2, 3, 4, 5. Li, la boucle. Licence, non, livre là. Okay? The license is in the book. Okay? All right. Any question? All right, let's go. 782, hearing aid. We're commencing now G. I like G. We're going to start. Hearing aid. Hearing aid. Who can put hearing aid? CNA. CNA can put hearing aid. Yes. Now, NCLEX going to ask you how to put it. Green box. Green box. Guys, do not go to NCLEX, fail your test because of the skill. If you're going to fail, I want you to fight all the way to 265 or how much PN get? Come in PN 205. Don't lose your license or not get your license for simple stuff. If you're going to fail, I want you to tell me, Miss Sonia, this test was the hardest test I ever. But don't fail and come back and say, the test was not hard and you still fail. Yeah. You understand? A baptize for your life on this test. Fight all the way to the computer shut down. And I know you will. Fight, fight, fight. You got 3 months of your life for it to be hard, and after the 3 months, it's all over. 4 months, 3 months, that's it. It be fini. And you know what you're going to say? God, it went by so fast. I don't know what to do. Don't call me every day. I got a lot of things to do unless you're going to help me type, right? After you get your license, students always say, what's next? Hell, get a job. Bring Miss Sonia the money if you don't need it, right? So work hard now. So the 4 months, Christmas is coming, December. We in September, October, November. Make a promise. By Christmas, you should be nurse. Say, let that be my Christmas present. That's it.
Amen.
Pray on it, claim it, write it on your calendar, and work towards it. Turn off the phone. See? Turn it off. Work towards it. You get me?
Yes.
Don't sit in here and say by January. No. You're going to say by Christmas. Or some of us going to say Thanksgiving. Or before that. But say, I want to be a nurse, claim it, write it. And work towards the goal. That's it.
That's my thing.
All right, guys? That's your goal. All right? Stick to it. Okay. Let's go. Hearing aid. Hearing aid, NCLEX asks you how to do it. 5412. Sassy. Box 5412. That's it. Box 5412. Pas mettre sel, pas mettre citron. Don't add, don't delete. Read that. Let's go. Encourage the client to begin using the hearing aid slowly to adjust. Guys, they're not going to give it to you like this. They're going to say, see, the book tells you the right way. So if the patient says something wrong, you know that patient needs further teaching. So when the patient says, I'm going to stick the hearing aid in my ear, with the note, with it very loud, they need further teaching. It's a slow process. And a lot of time when you put a hearing aid, you want to have the patient sit because it can cause them to be dizzy. Remember, hearing has to do with balance, okay? Hearing aid is very expensive. That's why when you lose it, the family like to choke you, right? How to clean it, pipe cleaner, toothpick. Those are the questions they ask you. Who can put the hearing aid? CNA. When does the hearing aid battery needs to be changed? Can the patient go swimming with hearing aid? They need further teaching. What other question they can ask you more than that? That's it. They can say, put it in order, how to put the hearing aid, right? It's right there in the book. If you want to put it in order right, you pull your skill book and you put how to do the hearing aid in order. That's it. What else they can ask you about hearing aid? You got it? All right. No hearing aid. Okay? Now, then we go into box 782, 5410, 5411. You need to know those. And 5410, 5411. How do you know? What will I do to tell you that I cannot hear? Give me all that apply. Listen, you know, if I used to go to bingo and I start poo-pooing on me, I won't go to bingo no more. If I used to go to bingo and now I find out I can't hear, I just don't go no more. See, a lot of students, they don't take that on NCLEX. When old people poo-poo on them or they cannot hear because of sign of embarrassment, whatever they used to do, they stop doing. When NCLEX asks you, give me all that applies signs that the patient have hearing problem. Do you know the students never take the patient stay away from from activities. They stay away from other people. So let me tell you what you take. You take frequently asking others to repeat. What? What did you say? What? What? My students like that. Sometimes I think y'all got to hear that. What? Straining the ear. Straining what cannot hear. Turning the head. Shouting. Or, let me tell you, lie about something. Let me explain. It's called confabulation. Confabulation, you also do it with Alzheimer's. Because I cannot remember, so therefore I lie to fill in the blank. I'll say, when I was in Haiti, either I can't hear or I forget, so I lie to fill in the blank so you don't think something is wrong. That is called confabulation. A lot of Alzheimer's do that, and when people can't hear, they do that. And you can get a liar too. When a person lies, and you know they're lying, they'll do it real quick. Ooh, you can catch them. It's called confabulation. Make sure you know that, okay? Now, continue shouting. What? Why you yelling? A lot of old people do that to CNAs. Miss Lee say, why you yelling? She's supposed to tell you that. A lot of people think old people blind, can't hear, can't see, can't drive. That's not true. That's not true. Old doesn't mean you can't do those things. It's just you aging. Okay? Now, answer question incorrectly. Raising the volume, avoiding large groups. There you go. Withdraw from social interaction. I stopped going to bingo. I poo-poo on me, I stopped going to bingo. I used to be a store manager for Walgreens in what we call Fort Lauderdale. It's called Bayview Drive. Rich people. They used to call me, Miss Sonia, I need you. My lady, her CNA, is coming to buy me Depends. I need you to go buy brown bag. See, Walgreens give clear bag. So they want us to take the depend, mettez no bag marron, and then stick it in the white bag. So when they bring it to the big old nice penthouse on the beach, people don't see Miss Lee on depend. And they the ones spend money at Walgreens, so yes ma'am, I'll get them. Every time they come, Miss Lee stuff in brown paper bag, nice. And you're going to put it in a brown bag, and then you're going to put it two clear bag, so nobody don't see. But people not stupid. They see a big bag, of course it's a bag. Right? And they'll tell you, do you see it? Do you see it? And they go to CNN. No, Miss Lee, you look nice. Back home. You see it? They so fun. Right? Now, what do you do to help me facilitate my hearing problem? What would you do for me as the nurse? Ready? Let's go. Use written words. Please don't go put me on no Facebook or bring me computers. These people cannot hear. Why you, Miss Lee, you know Facebook? No, Miss Lee don't know Facebook. Use written words. Plenty of light. Hand gesture. Guys, do you know you can communicate by using hand gesture?
Yes.
Right? And you know who communicates better? Watch. A Haitian and a Spanish, or a Spanish with an American. Who communicate better? Why? Because we're both bilingual. A Haitian and a Spanish will communicate better than you have American. It could be American black or American white trying to communicate with a Haitian or Spanish. It's very hard because certain things we say in Creole, in Spanish person already understand. You see that? Yeah. Bilingual. All right? You can communicate better with someone who is bilingual, although it's not the same language. Okay? Now, NCLEX asks you, with that bilingual, NCLEX asks you if we have a Haitian family, right? Husband and wife, speak Creole and English, and you have the kid. What language the child learn first? English. The Creole. The Creole. Let me explain to you. And that's an English. Kids, master the second language first, but they just don't speak it. They master it. They don't speak it until necessary, but they master. If it's Spanish, they know it, but they don't speak it. But they very understand. You say, Kathy, she know, right? No, I'm telling you. They will never speak it. So to you, you think, oh, Papa le coeur. No, because long as they understand it, they don't verbally speak it, but they understand it. Try it with your kids. You'll see the Spanish kids, right? And when you come from a country very small, like you come from Haiti, like 5, 2, 3, 4, 5, you will learn English just like that. Bam. Versus someone that came here adult. Adult, you will always have the accent. I came here at 2. My brother came here at 11. He still have an accent. I don't. I mean, if I tell someone I'm Haitian, they go, what? You Haitian? Right? But sometimes I have a little accent, right? The Creole come out.
What Creole?
What Creole? Creole qui fait nous passer. My mom say that all the time. She'll go, Kote Creole no so faire moun yo mti wap konjo moun passe with my bad Creole, right? Enough for you to pass, right? Facing the client when speaking. Yes, when you speak to people, please talk to me, but also remember, look at my culture too. Remember, Spanish people like closeness. White people like space. You can communicate right here. You got to be very careful. Harassment. Harassment. So you got to look at the culture also. All right? Keeping hands and other objects away from the mouth. See, black people and Spanish people, see, Caucasian people don't. But black people, that's how we communicate. White people, no, fall away and look at you in the eye and you said. And if you don't look at them, it's a sign of disrespect. Black people, if you look at them, it's a sign. Something, yeah, why you, yes, culturally. So you got to, when you answer a question, you also got to look into that too. And also Filipinos and Spanish people, before you talk to the wife or the children, you must talk to the man first. Vietnamese people, always men. Spanish people, men. Before you even touch the kid, address the kid, you got to address that first. Okay? Haitian no se vole. Haitian people, we kind of going away from that. Now the Haitian women rule, right? Because we bring the money home, so they follow the rule. All right, let's continue. Taking a normal volume and lower pitch. Rephrase. Rephrase. Rephrase is say stuff again. What did you say? Always rephrase stuff. So let me see if I understand. You said this. Rephrase, which is good. Okay? Use lip reading. Yes. Don't go, I don't understand you. Sometimes you can look at the person's eye and you understand. Like, sometimes a student have a question and I see you battling it. And I look at your eye, I already know what you're trying to ask me. I say, hold on, let me ask it for you. Sometimes I'm wrong, but 99.92 I'm right. You're battling. So sometimes you can look at the person to see what's going on with the person. All right? Use sign language. Use telephone amplifiers. Use dogs. NCLEX question. Yes. Train dogs. Those dogs are used for your eyes and your ears. And those dogs can go anywhere with you. And those dogs got things on them. So so people know that they're service dogs. Any question? No, box 5410, 5411. Now, okay. Now we're going to go into page 779. And I'm going to need you to, because this one is tough. 779, and you're going to go 780. 780. And everybody had a problem with this in school. So I'm going to help you so you don't have a problem with this. Okay? All right. Now, this is called a tuning fork test. I want to know, is the hearing working? I'm on page 780, and you're going to go E. You're going to put NCLEX on it. I want to know, are you able to hear? So the doctor ordered tuning fork test. Now, tuning fork test has two tests. Two tests. So the umbrella is tuning fork. Under it, there is Weber and there is Rhine. Ça, non test. Tuning fork has two tests, Weber and Riney. We're going to work on Weber first. Weber, I want to know, can Francis hear? The tuning fork semble une fourchette, right? It looks just like this, right? It's made of a fe, right? Like a fourchette, right? So they're going to take this metal fork and they're going to put on Francis right here, right? Now, I'm going to hit it. I'm going to ask Francis which ear you heard it the loudest. Now, Francis, whatever ear he tell me, but I'm going to use this one. Francis say, I hear it the loudest here. Now, NCLEX tell you, what does that mean? What does that call? That is called lateralization. It's in the book. Look in the book, Weber test. E. Okay? You want Francis to say, I hear the noises equally in both ears. But Francis didn't say that. Francis said, I hear it the loudest in this ear. That is called lateralization. Everybody see me? Right? Now, Francis will ask me, nurse, what does that mean? Can you give it to me in ghetto term? Because I don't know what lateralization means. Oh, what you say, I don't get it. So you're going to tell Francis, this is what it means. That means where Francis have the hearing problem is here. Where he heard it the loudest, that is the hearing problem. And that is called, listen, excuse me, I said it backwards. Where he heard the loudest is the good ear. It's the good ear. And that is called conduction. So I said, bon, Zoela. Wherever Francis hear it the loudest is called conduction. That's this side, conduction. So Francis gonna say, so what is wrong with this ear? The one he didn't hear it the loudest. You're going to tell Francis, it's coming back on. You're going to tell Francis that is called, okay, pow out. Test. I don't know, but we can still go. Let me just see if everybody's out. Don't get up. We gonna work in the dark. We okay. Test. Okay, shh. Stay with me. You guys know this weekend it's a hurricane coming, so be careful. But anyways, shh. What does that mean? Stay with me. Again, let me recap. You remember when I hit the fork, Francis said he heard it the loudest here. What does that call? That's called conduction, and it's also called lateralization. So now Francis is going to ask me, what does that mean in this ear? That means where Francis have the hearing problem is in this ear. That is called sensorial. Now, what does that mean for Francis? That means somewhere in his life, long down, Francis is going to need hearing aid. Sensorial hearing loss is permanent hearing loss. There's two types of hearing loss. We have conduction. Conduction means it's not that it's a hearing loss. It means no hearing loss, but it's not, or a little problem, but it's not permanent. Sensorial means it's permanent, and you're going to need hearing aids. Again, Weber, you hit it, you put it on his head, cling, I'm going to ask Francis where you hear it. Francis say here. That is called lateralization or conduction. What does that mean to the opposite ear? That means somewhere down the line, he's going to eventually need hearing aid. This is called sensorial, which is more of a permanent hearing loss. Any question? Now, that is called the Weber. So if I want to test to see if Francis can hear, I'm going to either do Weber or Rhine. Now, Rhine, school taught you air and bone. Bone means Sue Francis. I'm on Francis. I'm touching him. If I can hear, do I have to be on top of Francis? No. I can say Francis, 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 all the way to the back. If Francis can hear me, if Francis' ear is good, Francis can hear me. I don't have to be Sue Francis for Francis to hear me. So the school taught you bone and air. Bone and air. If Francis, in order for Francis to hear me, I have to be close to Francis, Francis' ear no good. Because guys, Francis should be able to hear me all the way in the back. Francis, Francis, all the way making coffee. Francis, he still should hear. You got it? Anytime you have to actually bone means says Sue Francis. Francis, ear problem. Okay? So Rhine goes like this. Look. The same fork. Ding. If Francis hear the noise better when I touch the ear, that means his ear is what? No good. What about when I hit it? Ding. He hear it. He hear it. He still hear the noise. He still hear the noise. That means his ear is good. If the only time he hear or he hear the loudest when I touch him, which is bone, his ear is what? No good. Any question? You must know the difference between Weber and Rhine. We got that? Yes.
Do we really make a difference when we hear something? Which ear we really...
Not which ear. Not which ear. Let me explain something to you. It's not, it depends on what test. Yes, it's a difference if you only hear it. Jenny, that means you got a problem.
I don't know which ear.
No, but it's different tests, baby. Jenny, Rane, Weber, I will touch Jenny. Now you're going to say, yes, it matters which ear, because that's Weber. Rane, it doesn't matter which ear, it's distance of the ear. You got it? Make sure you know that. Yes. Weber is the ear. What God did. Which ear Jenny will eventually get hearing aid? Weber. Rhine have nothing. Rhine, yes, has something to do with hearing aid, but it has nothing to do which ear. Now we talk about distance, because we got to do this for each ear. Rhine, you're going to check each ear. Weber, you're going to put it here. You checking both ears. Do you got that? Weber and Rhine are tests to check for ear. You got it? Make sure you know that. Right? Tuning fork. So you're responsible for E1, E2. Right? We cool?
Okay. You said the one you checked
distance. Distance. All right? Now, then we're going to go into, we did tuning fork, stay with me. Now we're going to go into 778. 778. 778, you're going to highlight every piece of this page. You're going to read this page 10 times. Highlight it, and I'm going to go over it. Guys, I need you to be quiet. This is very big on NCLEX. Let me tell you what we're going to highlight, and then we're going to talk about them. Ready? Highlight L, M, N, O, O1, O2, O3, O4. We're going to talk about that. Okay. 778. We're going to talk about I now. NCLEX asks you what to do en créole. L'anti paille tombe dans géa. L'anti dust tombe dans géa. NCLEX. NCLEX asks you when dust fall in the eye, what to do? When chemical fall in the eye, what to do? When two kids playing and one stick a pencil in the eye, what to do? You cannot go to NCLEX and don't know this page. This is very big on NCLEX. It's safety. Okay? So let's go. The eye. Foreign bodies. Foreign bodies is dust, eye, dirt. Fall in the eye. What do you do? 2A, have the client look upward, expose the lower lid, wet the cotton tip, okay? B, if the particle cannot be seen, have the client look downward, place a cotton applicator horizontally on the outer surface. This here, they put that in order. You see these foreign bodies? They give it to you on and popping. You need to know that. When dust, paille, dirt fall in the eye, what to do? You cannot go to NCLEX and not know that. Timoon, they ask that a lot. Guys, NCLEX about safety. Safety. What teaching? Make sure you know that. Then we go to penetrating object. Penetrating object, two kids playing. So I took a pencil, stick in the eye. What do? Ready? Do not remove it. Wait. Put a paper cup, come to the ER. When would you intervene? When the patient bend. When something is in the eye. You never bend. ICP. There's certain position. You're going to put a paper cup, come to the ER, just like that. What is the first thing the doctor going to order? Be careful with an MRI, because if the thing has a metal in it, so you got to be careful. The doctor normally would not try to order an MRI just if the object has metal. Okay, so let's go. 2, never remove the object. Cover the object with a cup. Highlight that. Do not bend over. Do not put pressure in the eye. Anytime they give you 4 patients and they say which patient you're going to see first, these patients, patient with chemical fall in the eye, patient with an object fall in the eye, patient who swallow or who drink acid poison, those are the patient you're going to see first. Again, which patient you going to see first? And be careful. They're going to trick you. They're going to say, patient with COPD have difficulty breathing, and you take that. Or they say, patient with chest pain. That's a trick. Anytime acid fall in my eye, object fall in my eye, these are the patient you will see first. Yes. Any question? We cool? So you need to know foreign bodies, penetrating objects, they not the same thing. Foreign bodies is fade, dust, penetrating objects, you know, fuel bagay. Chemicals is acid, bleach. I get you on my mama papa because the students don't know what I'm talking about. Foreign object. Foreign object, guys, like dust, right? Foreign object, dust, dirt, pipe, penetrating object, penetrating chemical. Chemical is not foreign object. Chemical is acid, bleach, something fall in the eye. You working for Walgreens and you making film, the camera, and the chemical fall in the eye. Now, NCLEX asks you, each facility supposed to have an OSHA sign, O-S-H-A. Any facility that deal with chemicals. OSHA say if chemical fall in your eyes, what's your initial nursing intervention? You wash the eye. You bathe it. You bathe the eye. It's still going to burn. And they ask you, but it's burning. It's still burning. What do? You continue to bathe the eye. Now, NCLEX asks you, how long you bathe the eye? Maybe 15 to 20 minutes. Now, and what do you do with the item? The bleach. You put it in a cup and you bring it to the ER. Anytime I swallow something poison, you take the vomit, a little of the vomit, you put in a cup, you bring to the ER. You got it? Anytime something fall in the eye, you take that little something, you bring to the ER so they can see what. Any question? You need to know how to deal with foreign object, penetrating object, and chemical. You need to know what to do when things fall in the eye, and you need to know when things fall in the ear. Sana tesmunyo. That is safety. Children, they ask you a lot of these questions on peds because as an ER nurse or if you're working at a clinic, you're going to see a lot of kids stick stuff in the ear, stick stuff in the nose. You need to know what to do. Any question? We cool? Make sure you know that. Oh, okay. I taught you organ donation. Where? Fundamental laws or fundamental culture. Well, let me clear up. Where laws I taught you, the people have to give permission at the DNR, right? DNR and give advance directive law. But I told you that what culture, right, is big with organ donation. True? Okay. Let's continue.
Sonia, can I ask you something?
Yes.
If the patient is on CNI, before he was on unconscious, he just signed to say, okay, do not participate, okay?
Okay, when he was conscious,
Conscious, okay. And after that,
he become unconscious.
yes. And after that, the daughter or the son asked him
What he signed before speaks. Whatever he signed before. Okay, let's continue. You can get an eye. Okay. The person who's receiving the eye, which is Jenny, is called a recipient. She's the live one. The person who's dead is called cadaver. Cadaver is the person who you going to, the doctor, not you, remove the eye and go put it on Jenny. Okay? So, let's go. Oh, organ donation. The eye. But we're going to start on two first. Once we do two, right? Two, then we're going to go to one, and then we're going to go to three. And that's the way I want you to study. I want you to read 2 first, then we're going to go to 1, and then we're going to go 3. Anytime a person is getting an eye, the patient is dead. The first thing, remember psych, death and dying. You're going to make the room cold and put oxygen because you're going to remove the eye. That's the deceased person. Now, so let's go. You got to care for the deceased person. So let's say the person died. Now the person, a cadaver. You're going to take her eye out, the doctor. So we must take care of her first. Ready? Let's take care of her. Ready? Discuss the eye donation with the physician. We did. The dead person, you're going to raise the head of the bed 30 degrees. She's dead. You're going to instill antibiotic, a piece of ice, and a sterile gauze on the eye. Okay? Okay? Let's go. Close the eyes, apply sterile gauze and a small ice to the eye. And you're going to close it. That's the dead patient. That's what the nurse is going to do. We prepare the patient for the doctor, the surgeon. Again, shh, guys, be quiet. Again, the first thing you do, raise, that's the dead body. I want you put 2, I want you put dead. Put dead. So when you read it, bien, dead. Right? Raise the head of the bed, instill antibiotics, close the eye. You're going to put a piece of ice, close the eye, and that's the dead patient. You're going to leave right there. Dr. Mark going to come in to remove the eye. So here's what Dr. Mark going to do. 1. So you're going to put doctor on 1. Dr. Mark, right, going to enucleate the eye. Enucleated means étiré. Remove the eye soon after the patient died. Put the eye in a solution. There's a water to preserve the eye. And they're going to store the eye properly so we can go put it on the recipient. So Dr. Mark can put it on the recipient. Now, there you go. Number 3, you're going to put a live patient. Alive. The person who's going to get the eye. So again, 2 is dead person. You got to prepare the dead person first. You, the nurse. Now the doctor going to come remove the eye and put it in storage. So now we're going to go to the live person and tell them the eye is ready. Priority with the live person is anxiety. Because now they're afraid because the dead eye is ready. No, it depends. Normally it's only 1 eye. I mean, if you're 2 eye, no good. You blind. There's no use to doing it. Normally it's 1 eye. And I'm going to tell you, what's that guy? It's an article came out this week. Rand Paul, you guys know he's an eye surgeon. Guess where he came from? Haiti. He did 400 eye surgery this week alone. A clinic in Haiti, all the people with glaucoma, he did a lot of eye. It was very big on CNN where all the people saying thank you. He did that so we could vote for him, but anyway.
But do you have to tell you where they get them from as the recipient?
Yes. Well, the recipient is a match. See, when we had to match you, the recipient already know where that we found one. We tell them we found one earlier, but now, see, what happened is people say, I'm going to have surgery. The day of the surgery, everybody is shocked. So it's not, the reason they're shocked, not because they didn't know about the eye. It's not that they knew. It's like, oh my God, it's here. I'm getting somebody eye. So priority is you gotta make sure mentally I'm okay.
Exactly.
Mentally I'm okay. So you talk to me, it's okay. Now you're not giving no false hope. Okay? Or you send the doctor to talk to them. Alright? So let's go. 3. Pre-op. Recipient may be told of the tissue. Assist with alleviating their anxiety. Assess the patient eye for infection. That is the person who's getting the eye. You remember the dead person, you had put antibiotic, you put the bed 30 degrees. You know where NCLEX get you? The bed. You see the dead patient, they get you with the small ice, and they ask you how you're going to position the bed for the cadaver. The bed is 30 degrees. You're going to put a piece of ice with antibiotic and sterile gauze. Say lion normal. The students don't know the positioning part. Right? Now, report the presence of any redness, watery. Prulet is green. Infection. Edema around the recipient eye. Right? Administer fluids IV, right? That is how you're going to prepare me. So far, Miss Sonia showed you how to prepare the dead, the recipient, the doctor, where he's going to put the eye once he removes it. Now I'm going to teach you post-op for the recipient, because the dead person went to the morgue. Now, post-op, after I receive the eye, here it is. Eye is covered and left in place 1 day. So NCLEX asks you, which one would you intervene when the patient say, I just had the eye surgery. When I get home, I'm going to remove it. No, eye patch stayed 1 day. And the eye patch is not taken, the eye patch is removed by the doctor. Okay? Do not remove, change dressing, Wessa. Monitor vital signs. Okay. After I get the eye, how do you know that my body reject the eye? No, NCLEX gonna get you. Fever. Guys, fever. Every time, you have surgery, you know you always gonna have a little temperature. I want to know, how do you know my body has rejected the eye? LOC. When the patient, before I talk to you good, now, where am I? Who is this? Be careful with eye pain. Guys, anytime I just had surgery, est-ce qu'il me pas get douleur? Est-ce qu'il me pas un petit chaud? Why you take that? That's the norm. Guys, if I take a knife, I surgery, I cut Jenny here. Touch Jenny, Jenny gonna be hot. Why? Because I just cut. Jenny, pain is the norm. Anytime you have surgery and the malade, anytime you sick, hell, pain gonna come with it. Stay away from the norm. I knew everybody was gonna say infection. LOC, enflé. You see that? But don't say pain, don't say infection. It is understood. Anytime anybody have any disease, anything you did surgery, you will see pain. You will see a little redness. But LOC tell you, hey, something is wrong. When the patient say, where are you? Who is this? Who are you? Hey, who are you? Before, when I talked to you, you was alert oriented. You telling me you don't know. Well, I don't know where I'm at. Or the patient get up, the patient fall. Bloop. Something is wrong. Now, what drug I'm going to give you to accept the organ? My old student. What drug I'm going to give you to accept the organ? so you don't reject it. TRAP program.
Yeah.
See, old student, you finish, you don't know that. That tell me, Sonia, you ain't ready to go to people test. Prograph. Prograph is the drug to prevent you from rejecting Sambaua. We will learn that in renal, at the multi-skeletal renal. But there's some old student here you finish, by side people from Miami, you should know. Don't look at me sideways. We should know certain things. Don't look at me all wrong. C'est pour nous connaître. Enough with Program, cell set. Make sure you know those drugs. Okay? Any question?
Yes.
Yes, ma'am.
Miss Sonia,
Yes.
the LOC,
Uh-huh.
the surgery. There's a period of time that you have to look for LOC because to me, I feel like.
Shh. Be quiet. Especially if you didn't know no damn program. You better not talk. Yes, go ahead.
I feel like after surgery, it's unfortunately like LOC swallow.
Let me clear that up. And you right, but let me make sure you understand. After surgery, because I was sedated, they was sedated, I may be a little off. I got that. Like I get up, ooh, hold me. But if before I was talking to you real good, now I'm like, oh, what is this? What's that? No. There's a type of LOC, darling. You have forgiveness or disoriented. So that's the word you're looking for. Disoriented. Meaning I'm off my rockers just a tad bit. But LOC means patient off memory. How can before I was so good, now I'm back on, I don't even know who I am, who you are. Something is wrong. All right? So patient can have ICP or patient can be bleeding internally. Or the doctor didn't put the, guys, when we do organ transplant, we got to get all the little veins, vesicles, normally. So what about if the doctor didn't sew something right? You remember they're human too. They wear one pants, they could be having a bad day, or they decide to practice on you. Oh, this don't work, let me put it here. You see that? Right? Nothing is perfect, people. Yes.
Now this patient is on cell-therapy.
Huh?
You're gonna isolate.
Yes. When you get an organ, kidney, liver, whatever I give you, listen, that patient immune is low in itself. If he prograph la même, it's an immune suppressor. So the drug, the surgery, everything has to be nice and clean, plus the drug, they call them immune suppressors. So you're going to automatically isolate that patient. Anytime I have any transplant, son pied en dedans, pied dehors. Visitors, you're going to limit. Bon, kids, ma'am, you don't allow them in like a 5-year-old. Oh, you remember, guys, kids always dig in. Yeah. Dogs, they don't wash their hand. Poo-poo, mommy, look. Visitors, you got to watch with kids. Or people who are, achoo, I got allergies. No, you don't need to come see me. You're not feeling good. I'm on a drug that can get me sick. You got it? Any question? We cool? Make sure you know that. So, 778, know it all. Please. When you have, then we on page 775, Mr. Glycoma, right? Now, when you have glaucoma, 778, true? 775. Sorry. glaucoma. Yesterday I talked about the drugs, right? Remember? I need my drugs now. Pilocarpine, Atlantin, True Salt, Vaseline, Marine. Remember? Know your drugs. AccuCert 40, AccuCert 20. What is that? The little disc. That is kept where? When I overdose you on pilocarpine, what drug do I give? Suppose you don't see atropine. What other words you going to see? Good job. All right. There is two types of glaucoma. Shh, be quiet. Acute close, chronic open. If I go to Macy's, which one I want to buy? Chronic open is I have something and eventually I have glaucoma. Glaucoma, you cannot see left or right. Guys, high blood pressure in the eye. You know why they say black people have glaucoma? More is because of diabetes. Spanish people have glaucoma too because of diabetes. This is high blood pressure in the eye. There's two types, acute, close associated with pain. This here, no pain. Now, okay, you give medication. The patient cannot see left or right, so the patient really cannot drive, right? And you use these drops. Now, for acute, we will use mannitol, which is an asthmatic. What about NCLEX don't have mannitol and they put asthmatic? Would you take that? Make sure you know that. Any question with glaucoma, make sure you read glaucoma. Anytime I have glaucoma, I cannot use my Dratic. Glaucoma patient don't use atropine. The only time glaucoma patient use atropine is when you overdose me with pilocarpine to reverse the overdose you give me. Any question? Nice, right? We cool? Good. Now we're going to go to page 774, and we're going to do cataracts. D, yes. Yes. Oh, m'a fait retinal detachment. Donne-moi, baby. No, calm. I'm going to answer it for and I do it instead. I'm going to tell you what your NCLEX question is. Let's do glaucoma and we're going to do retinal detachment. And I'm going to answer your NCLEX question. Okay, let's go to cataracts. Cataracts, all age get it. I mean, not all age, excuse me, all race. Black people, white people. Cataracts is more associated with aging, l'âge. Early sign of cataracts is the patient have problem vision, seeing. Late sign of cataracts is that opaque, bagay blanc. Cataracts, we give you drops, and a lot of times the drops they give you is Mydractic, and then we do surgery. Now, NCLEX asks you 50 million questions on the surgery. Cataract surgery, right? After cataract surgery, avoid eye straining. Avoid, guys, let see straining. NCLEX not going to say a patient had cataract surgery. The patient used the bathroom. No, straining of the eye is reading. Now you guys reading more. Don't you see your eyes hurt? And now your eyes bad. You find yourself saying, God, I got to go to the eye doctor. It's because you're using the eye more. That's straining. So how can I strain the eye? Watching TV. Reading. Using the computer. Make sure. When the books say avoid eye straining, NCLEX eye straining, They're going to put reading, using the computer, watching TV. Any question? All right. Avoid rubbing or placing pressure on the eye. Avoid rapid eye movement. Bending. Take measures to prevent constipation by giving you a stool softener. Right? Let's continue. Use eye shield. So here it is. I get the eye cataract surgery at 10 o'clock. The doctor sent me home today. When I go home, they're going to cover both eyes. Tonight, I'm going to sleep, cover both eyes. Tomorrow, here where I got the surgery, I'm going to cover this eye. I'm going to, cover the good eye and leave this open. Did y'all get that? Again, I got the surgery at 10 o'clock. The doctor covered my eye, I go home. Tonight, I will cover both eyes. Tomorrow, I will cover the which eye? The good eye, so make the strong eye work. Because if you don't use it, you will lose it. Any question? Now, when would you call the doctor after cataract surgery? Pain, drainage, right? The patient say, I can't see. That's medical emergency. How would you position the bed? Not too high, not too flat. 15 to 30. Or if the book say, if NCLEX put 30 to 45, take it. No high because ICP. And no low because ICP. Any question? Cornea cataract. Now, let's go to page 776. Retinal detachment. Number one, ask NCLEX question. Retinal detachment, GHE. Look at the picture. Which part of the eye is ripped? The retinal. Page 776. Oh, I'm sorry, I said wrong page. Pardon. 776. You see it? The eye ripped. Y'all see the eye on top. GHE, right? Now, who gets this? Old people and young white boys. They don't know why. They playing baseball. You hear them in the field. All of a sudden, Mommy, I cannot see. The retinal rip. Now, what would they say? They will tell you, I see flashes. I see black spots. Anytime the child tell you, I see black spot, that means they're bleeding in the eye. Blurred vision. Or they say, I see curtains. If you do curtain, that means the child has problems seeing. Now, NCLEX asks you, what's priority? Now look, one eye shielding, one. Normally, it happened one eye. But if you don't keep the head straight, if you move the head, the other eye will shield it too. Rip. So it's normally one eye. So NCLEX asks you what you do. Right in the field or whatever the kid is, the first thing you're going to sit them down. Make sure you uncross the legs. Sit. You go, here it is. Remember this eye shielding. Rip. One eye, but you're going to cover both eyes. And you're going to keep the head straight, because if you move the head, the other eye going to rip also. Did y'all hear that? And NCLEX asks you, which eye you going to cover? The ripped eye, the left eye, always both eyes, although only one is ripped. Any question? We cool. What, did I answer your question?
Yeah, but it was about the curtain.
The curtain?
Yeah.
That's on NCLEX. Now, what will I do for Mark? I will do surgery. There's different type of surgery you will do. The number one cheap surgery is called buccosclering. Ils semblent sentir for du marrer, géa. Buccosclering, which y'all have a picture in your book. You see the belt That is the cheapest, and insurance love to pay for it. It's cheap. But let's talk about all the different surgery. Ready? Let's go. Draining. Draining is you can drain the fluid from the subretinal space that the retina can return to the normal position. B, you can do something called cryosurgery or something flat like ice, an ice probe applied to the sclera, right, to stimulate inflammatory process to heal the eye. That's a second one. The third one, which they do also see, is something called diathermy. Diathermy is the use of heat to, like heat show to kind of seal the eye, right? And D, laser, they don't normally do. E is the number one asked NCLEX question, the scleral buckling. Fodi son sentiron, yo man rebounger. They tie the eye. Now, after surgery, that's where your questions come in. So they can do any type of surgery they want. Now, what teaching we going to teach after surgery? Ready? Let's go. Maintain eye patch. Yep. After surgery, they put a patch. Monitor for hemorrhage. Oh my God. Anytime after retinal detachment surgery, the patient vomit is a medical emergency. DPO for me. So when you have a patient, right, you got to watch the patient for vomiting. You got that? Now, after eye surgery, you are in bed for about 2 days. In bed, you cannot get up. You know why? Because remember, hearing, eye has to do with what? Any question? Now, you're going to watch the patient. You're going to teach them no watching TV, no reading. They're going to give them stool softener. All right? No bending. So NCLEX asks you which activity you're going to question. When the CNA, certain activity the CNA is doing with the patient. Guys, listen to me. NCLEX, the book teach you the good stuff. You now must understand when NCLEX give you something that is no good for you to question. So if you don't know the good, how you going to understand the no good? Each disease I stand up here and do with you, you must understand how to position the patient, what caused the disease, things to prevent the disease. And if you see the patient doing something wrong, you should question. That is what NCLEX is about. The book teaches you the good, so when you see the no good, you will intervene. Any question? We cool? That is called retinal detachment. And let me explain to you again. Elderly people get it, and a lot of young white Caucasian little boy, 9, the one that plays softball. You don't know why. ER, you see a lot during summer and softball season. We cool. Okay, let's go to page 774. 774. 774, legally blind. Okay, anytime, come here, Francis. Francis is taller than me, but I'm going to use him. NCLEX asks you how to walk with a blind patient. You must know how to walk with a blind patient, how the cane look for the blind patient. Now, not only how to walk with the blind patient, how to walk with any patient with different problems. Stroke patient, how to walk with them. Blind patient, how to walk with them. a patient after surgery who's weak, how to walk with that. So first of all, we're going to talk about how to walk with a legally blind patient. A blind patient, right, will hold my elbow. My body will be close to him, tight. Let me tell you, NCLEX will say hold hand, hold arm, hold elbow. I will always walk 1 foot ahead of him because he's blind. So he needs to be behind me, I needs to be front. So I say blind. Now, when you're walking with a blind patient, or when you're teaching a blind patient how to use the cane is white with red tip. When you are using the cane, you squat, walk, right? Now, anytime you start with the cane, you need to find a focal point. Focal point means koto pe commencer. So I'm teaching Francis. I'm going to say, Francis, we starting here, right? So you're going to tell Francis the first thing he needs to do is find a beginning. So if he get lost, he will, if he hear the same noise, he will at least know where he started. Now, if Francis have stroke, there's a way I'm going to walk with Francis. So first I taught you how to walk with blind patient. Now I'm going to teach you how to walk with a stroke patient. If Francis walking by himself, he has stroke. This is the stroke side, this is the weak side. So Francis have a cane. Always remember, now he walking by himself. You're going to go cane, good leg, bad leg. Cane, no, cane, 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 because that's the good one. Good leg. And then you're going to drag the bad leg. That's walking with a cane. Now, if I'm the nurse walking with Francis, who has a stroke, so I'm the leg for him, you're going to make sure he walk with the, put the good leg first, good leg, this one. All right. Umem, you, because you the one helping him, you're going to move. You see that? That is stroke. Now, Francis is weak. He just had surgery. And you walking with him. You walk, you letting him walk, but you following him because you don't want Francis to fall. Anytime you're walking with a weak patient, you always walk behind him. He have a belt, right? And you walk, you see how I'm walk, Francis? You see? Look at me. Why? Because if Francis decides to fall, I'm going to go poof. Right? You see that? And I'm going to lower him to the floor. So NCLEX asks you different ways you walk with a blind patient, a stroke patient, and how to walk with a weak patient. Weak patient, you walk behind him. Stroke patient, you walk on the side of him. Blind patient, you walk 1 foot ahead of him. And he hold your what? Elbow. NCLEX question on his side. We cool? Okay. Shh. Take a break. Shh. Look, when you come back, we got 2 things I and here we're going to finish. And we're going to do pre-op, post-op. We're done.